Branin today. Ivy is a naturopathic doctor. She's based out of New York City, even though she's in LA right now. Her practice is called Simplicity Health Associates. So Dr. Branin does not treat disease with a one-size-fits-all approach, but rather sees each patient as an individual with their own potential for optimal health. She supports people in their desires to feel good and feel good about themselves using naturopathic principles of dietary and lifestyle management, homeopathy, visceral manipulation, botanical medicine, and craniosacral therapy. So I just threw a whole bunch of words out there that even some of them I had to Google and look up what exactly that meant. So I feel like before we even get into our topic of the day, which is all about birth control, a lot of the questions I was receiving from people were, what is a naturopathic doctor? So I figured you would be best to answer that. So I figured we'd start there.
Sure, thank you. And in a way, sometimes actually what a naturopath is a very difficult question, because even within naturopathic medicine, we all practice very differently. But like one of the things I always like to talk about specifically when I give talks is our principles. So the first principle is first do no harm, which is very similar to what most mainstream medical doctors practice. Also, doctor is teacher, which is exactly what our little conversation is all about. But and even in my practice, it's not just about telling my patient why they need to be taking certain things, but also explaining more in detail blood work, which a lot of the conversations, it just isn't happening in most mainstream medical practices. Other principles are preventative medicine, also looking at the whole person. And one of the big defining characteristics of naturopathic medicine is this idea of the healing power of nature. And basically that everything, like our bodies have like this innate intelligence. And so basically activating that and using that power to heal the body. And just as you said before, instead of using drugs to heal my patients, one, I'm always really trying to find that cause and using natural therapies to address the cause.
It's so fascinating. So how does that really differ explicitly from what a conventional doctor would do for their patient? If that patient came in with the same disease, what do you do differently than a conventional doctor?
Well, it's basically just a whole different tool set, really. Well, one, the unfortunate thing is just the way that the medical system has modeled itself. Most people only have about like 10-15 minutes to spend with their doctor. And also doctors have to operate in a specific scope of practice, so only maybe having drugs as an option versus working like how I can recommend diet or maybe exercise or different herbs. A conventional medical doctor really only has a certain tool set to operate with. And a lot of it also is more just looking at symptoms. And that's basically, in a way, we're talking about birth control today. And the big thing, when birth control was first developed, obviously it was like for prevention of pregnancy. And then they realized by basically suppressing hormones or suppressing the production of hormones, it could help with all these other conditions. But basically it's just masking the symptoms rather than actually really going to the root of the problem.
Right. So you would say instead of just prescribing a medication or prescribing, because you don't prescribe any medications right. in your treatment of patients, instead of looking at just the disease and saying disease diagnosis and this is the treatment protocol, you look underlying, you look deeper at all of the things that are the underlying factors of the cause, the core of that problem.
Exactly. And I also have also luxury because I am spending so much more time with my patients. And then even,
how much time do you spend with the patient on average?
Probably almost too much time. So typical first patient is anywhere from an hour and a half, sometimes 2 hours, and then follow-ups are hour, 30 minutes.
That seems so appropriate. The amount of questions you must need to ask somebody and really unpack like their history. How is it even possible that someone could get to those answers in 15 or 20 minutes?
Right, and it's also, it's not even just the time spending with the patient, but a lot of like research after. I mean, I've definitely had some patients come through my office with conditions that I just wasn't really, we didn't really study in school. So I had to do even more research to see why the person would be having this condition.
I think it's fascinating. I did a live with the Warrior team yesterday, and I explained when I had the idea of what I wanted to do in nutrition and how I wanted to help people. I didn't know anything. I didn't know what naturopathic medicine was. I didn't know it existed because I just didn't, my research, I guess, didn't extend that far. And what I thought that I was going to school for, which was to become a registered dietitian, in my mind, I was hoping to eventually practice in the way that you actually practice in the treatment of your patients. And, you know, now I'm here 10 years out from college, have my degree and my registered dietitian credentials, and it took me so far, and everything that I've learned thereafter has been my own research, my own studying, my own curiosity, and just understanding that life is way more complicated than a food pyramid, and there's way more that we need to understand about our own selves to be empowered to help ourselves. And that's kind of